Bion3 contains vitamins and minerals that play an important role in metabolism, affect the functioning of organs, and importantly are important factors, especially vitamins A, D, E, C, B6, B12 and folic acid and the minerals, necessary for the full functioning of the immune system. If the body doesn't get enough vitamins and minerals, then some metabolic reactions slow down metabolism of carbohydrates, fats and proteins. This leads to disruptions in the normal functioning of organs and systems, as well as to suppression of the immune system and the development of infections. Unfortunately, the body is unable to synthesize vitamins except vitamins D and minerals and needs to be supplied from outside. Indications: an additional source of vitamins, minerals, and probiotic microorganisms, bifida and lactobacilli. To maintain and restore healthy intestinal microflora with unbalanced nutrition, stress, chronic diseases of the gastrointestinal tract and other organs, as well as in the complex therapy with antibiotics. To strengthen the body's immune system. How to use: adults and children over 14 years old, 1 tablet daily with meals, swallowed well and washed down with plenty of water. The duration of admission is 1 month. If necessary, especially in winter and spring, the course can be repeated. When taking antibiotics, it is recommended to take 1 tablet of Bion3 daily, 2 hours after taking antibiotics without chewing, and drinking plenty of water, 1 glass. Don't exceed the recommended dose. It is necessary to start taking Bion3 at the same time as you start taking antibiotics. Pregnant women and women planning pregnancy should not exceed the recommended dose. Contraindications: individual intolerance to the components, renal failure, hyperthyroidism and hypercalcemia, hyperparathyroidism, and hypercalcuria. Before you use it is recommended to consult a doctor. Bion3 should not be used as a substitute for a complete balanced diet and a healthy lifestyle. Biologically active additive is not a medicine. Side effects: skin allergic reactions are possible. Avoid concomitant intake of other foods containing vitamin A and D.